training in this would never be enough because we always get asked more and more about it.
If a child's saying, "Love you, Paula, night," and you say, "Thanks, mate," how does that make a child feel?
Is there anything you get asked for over and over and over again that you think, training in this would never be enough because we always get asked more and more about it?
I think probably around positive behaviour support, or as I always call it, proactive behaviour support, because what works for one child doesn't work for another child necessarily. I have 3 children myself. What works for my 14-and-a-half-year-old is not the same thing that works for my 7 or my 12-year-old. So it's, I think, where we've come a really long way in showing children love, nurture, care, where you have people who have been in the industry a long time, many of them often still struggle with that change in narrative, that actually it is okay for you to hug a child. It is okay for you to say, actually, night, love you, mate. You've had a great, it's okay to nurture children. And I think over and over again, people question, so it is okay to tell a child you love them? Yeah, of course. If a child's saying, "Love you, Paula, night," and you say, "Thanks, mate," how does that make a child feel? Actually, we do love spending time with you. We do love you as an individual because that's why we're here and why we do. But like I say, I think again, that's another thing that people question because how the narrative and approach has significantly changed over the years.
I guess it's also about being authentic, isn't it?
Yeah.
And showing that, and the children know anyway. Children feel.
They do, yeah.
It's about feeling that and naming it. I was just thinking about the sort of things you and I get asked about as a very sort of a topic that gets revisited.
Yeah.
I think people are fascinated with trauma.
Yeah.
I'm sure you get asked about trauma as well, but people are fascinated about people's trauma history and how that might play out in the current presentation, what that might look like, how they might be able to repair some of that. And attachment is another one.
I was just about to say,
were you going to say attachment?
Yeah, that's another one. Attachment and how to repair when a child has either an attachment diagnosis, so some sort of attachment disorder, or again, looked after children, we know there are levels of attachment needs because they don't live with their parents' primary carers, and how again you support the building and maintaining of those attachments, especially when children might have disorganised or attachments towards their carers.
Yeah, and how they protect themselves through the functional elements of quite disordered attachment, because it's protective of the self, isn't it?
Yeah.